Hello, this is Ted Roos with the ACR TBI Tetric project team doing a demo recording for Dr. Anthony Pacifico for award number W81XWH-11-2-0191. Title of the project is Medical Imaging Software Framework for Rapid Development and Clinical Interoperability, Year 3. And we have with us here to do the demo Dr. Ben Odry with Siemens, who is currently in Princeton, New York, Dr. Laura Coombs, who is the project PI from the ACR in Reston, Virginia, and Dr. James Stone, who is our primary clinical investigator in Charlottesville, Virginia at UVA. And I'm going to turn it over to Dr. Odry. Go ahead, Ben.
Right, so good afternoon. So this is a project where we worked with ACR and more specifically the platform Triad for clinical trials, and we are trying to communicate from Triad to one TBI dedicated viewer that we developed at Siemens. And the data that you see actually on Triad are data that Dr. James Stone has uploaded. Maybe Dr. Stone, maybe you want to tell us a bit about those data sets?
Yeah, so basically what we did was to go into our clinical imaging experience here at the University of Virginia and to look specifically for patients who had both a diagnosis of traumatic brain injury and also had received an MRI at some point during their in-hospital or outpatient course. We have a database here at UVA that has been established for about the last 20 years called the Clinical Data Repository, and that allows us to be able to essentially search the entirety of the patient record based upon ICD-9 codes and also CPT procedural codes. So what we essentially did was went through and did a query of that database for the ICD-9 code associated with traumatic brain injury and the CPT code associated with magnetic resonance imaging of a variety of different forms. And we ended up isolating 30 patients who had both a diagnosis of TBI and also full MRI data sets from the overall cohort that was identified. And we ended up pulling those data sets down from our packs and then making them available for upload through the Triad viewer for the purposes of this study.
All right, so as I was showing, so we have 30 cases, really rich number of sequences here, much more than we usually see for regular examination of TBI patients. Some of the data are already processed, DWI-XL, DWI-ADC we saw earlier, so the diffusion maps are already processed in some cases. Here, for instance, ADC, we have images from the carotid left and right. Okay, so the process or the goal of the grant was to show the interoperability. So, for instance, if you have a site in Iraq and Afghanistan and you have data that you want to load, so you want to be able to load the data sets quickly in the cloud and assess whether there are lesions in the specific subject. So two things here. We have Triad that allows us to load the data sets in the cloud and be actually linked to some platform to read the data specifically. So what we did at Siemens Healthcare Solutions was to develop dedicated software for TBI. This software was for requirements quality assessment. So we're going to show some features of the software today. So here on this one case, I selected DWI actual and also a FLAIR study. So, and I select view with the XIP viewer, which is this TBI viewer that we developed under the XIP platform, and I click on view. So right now the Triad is going to call using this DICOM part 19 standard the TBI viewer and going to pass those data sets to this prototype. So data are being passed first and then loaded by the viewer. So this is an anonymous case. We have the FLAIR actual, the DW actual. We can see the data just by clicking on the series. you have the basic manipulations of the MPR, scrolling, windowing level, and so on. In some cases, for instance here, this is a DWI case where you have actually two series. I guess it's a B0 and then an average maybe of the DWI. So you can window level both series. And the key function of the prototype was, in case you have multiple DWI, multiple orientation, or multiple volumes of fMRI, was to be able to do motion correction of those volumes and see the displacement across volumes. So in this case, we're not going to have that much to show. This is our B0, this is our average DWI. So one of the possibilities of the prototype is to have annotation, so we can select the regions, and it's going to give us the histogram of both regions on the B0 here and the average DWI here. You can change the bin of the histogram, so you see that here the values go from 0 to 1300, and on the DWI they are much lower. In case you have a lot of volumes, and this is important in fMRI or when you have multiple DWI for quality instruments, you can actually track basically the signal ratio or the mean of the region over the series and see if you have a drop. And if you have a drop, you can actually get rid of or exclude the volume where you have a loss of SNR. So you can compute your diffusion maps on the volumes that are actually have a good SNR. One additional thing that we can have is to actually add the reports. So this button means that the review is done, the task is complete. Then we have a pop-up window informing us that overlay changes. There are overlay changes. Overlay information have been changed. If we want to save the changes, we say yes. And the findings are going to be saved into Triad. So here we see that the file containing both the markups, the annotation, and the comments is saved into Triad. So right now I'm going to head it over to Dr. Stone.
All right, so I am pulling up. All right, so I am going to subject ACR 30 here and expanding that subject, and I can see that there is an attachment here.
So now we can select the same studies that we had that I opened from in Princeton, and then you can click on View on the top. And the prototype is going to load the data itself as well as the file. So Dr. Sony is going to be able to look at my findings and the report that I had and build upon it. Right, so if you click on this button for the reporting, okay, so you see the comments, so you can potentially change and say okay. But that's it. So hit task complete and save. Yes. Okay. And then you can close. So go back to ACR 30, and you should have 2 attachments now. Alright, so on my end, so I can see that we have 2 attachments here. Alright, now that Dr. Stones has pushed back his file, we're going to try to load it into the viewer and see his comments. So we have to select which file we want to load. Alright, so here the comments from Dr. Stone, enlarged ventricles, right to left, and so on. So everything was pushed back from University of Virginia to ACR to Princeton. And of course I can add on this and so on and so forth.
And that concludes our demo. Thank you very much for your time.